The World Health Organization right now is holding a virtual briefing on the state of the coronavirus pandemic in Africa. It's also expected to give an update on the continent's COVID-19 vaccine development. I want to listen in.
Including the Bill and Melinda Gates Foundation. So let's see what we can learn from Africa. Africa obviously having dealt with various viruses and illnesses. Professor Kalibo has been involved in vaccine development in Africa for many years, especially working on both an HIV/AIDS vaccine and the Ebola vaccine. So thank you so much for joining us, Professor. What can you tell us about the common challenges, COVID-19 vaccine research, and what you're faced with other vaccines? What lessons can be learned?
Thank you very much for the opportunity to contribute in this press conference. I also thank and welcome Dr. Moeti and Professor Madi. I think all of us, as you have heard, this pandemic has come, although the extent of the epidemic in Africa has not reached the same extent as in other places, but we need to be prepared. And we all believe that a vaccine will play a major role if we are really to manage this outbreak. Before I go to the other experiences, we are also preparing ourselves here in Uganda from the very top, from the government, from the president, encouraging us to participate in COVID vaccine activities, using two approaches: encouraging our scientists to come up with concepts to develop our own vaccines, and many institutions are really putting their heads together, and the government has also promised some funding so that we can come up with some concept, but also to look around for the best, the good candidate vaccines to be tested in our country. So we are open to this, just like what South Africa has done. We are discussing with other developers to test the COVID vaccine, and hopefully now we're working on some protocols. But going to other vaccines and the experience that we have had, we participated in the first HIV vaccine trial in Africa, in which we conducted in 1999. We have participated in other vaccine trials of Ebola, and now we are preparing one for Rift Valley fever. Initially, there were a couple of challenges, and these challenges are spread. They are political, there are social challenges, there are legal challenges, there are ethical barriers, regulatory barriers, media, issues in the communities. So there were a number of issues that we did face. But what I learned is that as long as you communicate well, you inform the public, you inform the communities, you address the issues, work together, you are likely to overcome some of these challenges. We didn't have at that time very good ethical and regulatory processes for vaccine trials, HIV vaccine trials, but we worked together with international communities. Yeah, WHO did help us quite a lot, develop capacity, training, exchange of ideas, and we developed, working with international partners, good regulatory systems, ethical review systems for our vaccine studies, and eventually the first vaccine trial, it took us like 3 years from the discussions to the initiation of the study. But the latest trials of HIV vaccines were a little bit more straightforward because of
the World Health Organization briefing on coronavirus in Africa and also the readiness of a vaccine. We'll keep a close eye on that briefing and return to it a little later.